Pickleball is a fun and fast-paced sport that has become extremely popular. It's a great way to stay active and socialize. However, like any other sport, pickleball comes with its own set of potential injuries. So today we're going to discuss the 5 most common pickleball injuries and how to prevent them.
So number 1, strains and sprains. These typically are caused by sudden explosive movements or by not warming up properly before playing. Uneven surfaces and incorrect footwear can also contribute to those injuries.
Some common examples we see are sprained ankles or a strained hamstring.
So the second most common ones we see are tendinitis or tendinopathies. These are typically caused by repetitive motions, improper technique, or overuse. In pickleball, players use the same muscle groups during rallies, which can lead to small micro tears in the tendons.
Some common examples we see include tennis elbow or pickleball elbow, which is when the tendons on the outer part of the elbow become inflamed due to the repetitive arm movements, or we also see Achilles tendonitis, which can occur from excessive jumping or sprinting.
Rotator cuff or shoulder injuries are the third most common one that we see. The rotator cuff is a group of muscles that help stabilize the shoulder and can become injured due to frequent overhead motions like smashes or serves.
Some common injuries we see are shoulder impingement, which is pain in the front of the shoulder with movement, rotator cuff tears, which don't always need surgery, and bursitis, which is inflammation of the bursa or fluid-filled sac that cushions the shoulder joint.
And number 4, knee injuries. These are typically caused from frequent lateral movements, pivots, quick changes in direction, or repetitive jumping or even sudden stopping.
Common injuries we see are runner's or jumper's knee caused by repetitive jumping or aggressive movements or landing. Meniscus tears can also occur from twisting motions or suddenly changing directions.
And then the last one that we see, of course, is back pain, especially low back pain. It's typically caused by twisting motions or poor technique due to muscle imbalances, such as tight and stiff hips or a restricted mid-back that limits rotation in the spine.
And some common injuries that we see are low back strains and disc herniations from the repetitive twisting of the low back, especially with low volleys or ground strokes.
Understanding the most common injuries and how to prevent them can help you enjoy the game safely for years to come. By warming up properly, practicing good technique, and focusing on strength and mobility, you can reduce your risk of injury and stay on the court longer. Always listen to your body, and if an injury does occur, seek help early to ensure a full recovery as quickly as possible.
So if you're battling an injury or ready to get back to performing at your peak, give us a call at 785-842-7325. We're here to help.